questions, I will now pass the floor to Dr. Einat Perry, who's from bEaspd Shapiro in Israel. Israel is well known to be much more advanced in terms of the deployment of the vaccine than at least in most parts of Europe. And so I'm sure we can learn a lot, and also Mr. Patrick Levy will be joining her in the intervention. So how is the process taking place in Israel?
Okay, so good afternoon from Israel. My name is Patrick. I'm working at the bEaspd Shapiro organization, which is one of the oldest organizations for people with disabilities, with many services, mainly in education, but also with a leadership center. And within the leadership center, we have cross-disabilities groups. You can see the list right now. One of the groups is the Forum for Health of People with Disability, which is a forum of 22 women and men from all disabilities, from all backgrounds, from all age, from all over the country. And Einat is one of the members of this forum, and she's going to speak with you about the situation right now in Israel as we speak. Einat.
Okay.
Please.
Okay. First thing, I'd like to just tell you a bit information about Israel. The total population is 8.8 million people. We are a young country. We have 23% kids. We have two special populations, 1.8 million Arabs and 1 million ultra-Orthodox, which are less exposed to the media, which is very important for Corona. For people with disabilities, we have 1.5 million, including many children, and a third of which are above 65, which is direct risk for Corona. We are considered as an island country because entrance is mainly by air and can be controlled quite easily. It wasn't done, but it may be done. We have a very high level of free and available healthcare by 4 providers for all the residents. Okay. For these reasons, Israel was selected to be a model country by Pfizer, allowing very fast vaccination, and you will see the numbers. It's quite nice. We do have fragile political situation, which kind of really disrupt the way of the vaccination done. Current status in the face of the vaccination, we still have high morbidity and mortality due to COVID-19. Although we did have a lockdown of 1 month and it didn't work, we are optimistic and we hope that the vaccine will start working soon, because new cases now is roughly 8K per day, and the hospitals are starting to get too full. British mutation is 30 to 40% of the isolation, which is quite a lot. Rate of vaccinations in Israel for the moment is 2 to 3% of the population every day, which is huge rate. 2.7 million people, 31% of the total population was vaccinated at least once, and 13% was vaccinated twice already. We also have 500,000 healed people that we don't vaccinate for the moment, though it seems that the new mutation might hurt them twice, might become a problem, and they might be vaccinated in a time. Next. A bit of epidemiology. The airports were really closed only yesterday. It means that all the mutations available are here and in high numbers. We started to see also the South African mutation running in the population lately. The British has a higher infection rates, higher mobility, and we see more and more patients in children and pregnant women that were not in the first year of the epidemic. So we consider it might be because of the British mutations to look for it. We have a very high morbidity in certain populations, which I mentioned before, mainly due to low ability to inflict full lockdown on this population for political reasons. And it seems to have a connection also with the media exposure, because the regular population is more exposed to the discussion over the disease and the vaccines, and the vaccine rates amongst those two populations are lower than the normal population. Next. As for vaccines priorities, we started with a copy of the recommendation by the ECDC, which were very, very good. And we modified how to say, on the run. First priority, we vaccinated health workers. And I'm very happy to say that we can already see decrease in new cases of health workers. It means the vaccine is working. For first priority, we also have elders and their caregivers. It's very important to say whenever anyone is getting a vaccine, he can have his health worker, caregiver, given the vaccine at the same time. No question asked. They don't care if the caregiver is in another service provider. They don't care who is who. They vaccine the caregiver if he gets to the vaccination premises with the sick people. For first priority, we also added low lung reserve patients, immune suppressive patients, and for your information, people living in mental health institute, hospitalized, prisoners, welfare, whenever they cannot, the population is more crowded. And their direct caregivers were given vaccine the same time and in the same place. Next. For second priority, which is chronic conditions associated with severe COVID-19 sickness and school and kindergarten workers, and what is called first responders, the police, the regulation of the vaccination protocol demanded the health provider organization to create a special case committee. It means that anybody that thinks that is in a bigger risk than others can apply to this special case committee. Though I might say that this special committee was not talked among the people, so they can work easily without too much stress on the committee. Some pros and cons of the priority vaccination, prioritizing for the people with disability. First of all, as you know, not all people with disability are at higher risk. We gave the GP, the general practitioners, an option to choose who is in a greater risk and who is not. And if the GP could not do that, he applied to the special committee to do that. Most of the people with disability are at higher risk due to cognitive or mental issues or dependence upon health were vaccinated at the first priority. They are already vaccinated. And special cases, I told you, allowed by the committees. We have seen problems with rare diseases and conditions that are not very well defined, such as chronic fatigue syndrome, that according to the specialists, is at risk, but GPs in Israel don't know this disease very well, and they didn't forward it to the special committee. Next, I discuss that. Due to the fast vaccination rate and short time of preparation, first of all, I must state that home-restricted patients only started these days to be vaccinated, though the risk for them might be the highest. The problem is that Pfizer vaccines is not very easy to travel to the patient home. So we used Moderna vaccines for that. The Moderna just arrived in these days, so that's why it was delayed. Also, there is no special routine for fragile patients. As you've seen in Sweden and also in Israel, patients that are very sick and in very old age, let's say 90, 85, might get very sick and even die from the vaccine itself, not because of a real side effect, but only because they are too fragile to go to the vaccine premises, go back and kind of handle the vaccine stress. So
sorry, you have 2 more minutes.
I don't need 2 more.
Okay, perfect. Thank you.
Thank you. So I think it would be better to vaccinate these patients under hospitalization. Also, we have seen that since the demand for vaccination was very high in Israel, some vaccine premises allowed too many vaccines to be done. I mean, less prioritizing, and some of them were too strict. So you have to find the even way in between. That's all from my side. Thank you for listening.
Thank you very much, Dr. Einat and Patrick, for that overview in Israel. I think important progress is being made, but of course, more to come. That seems to be the way it is with COVID. You think you're reaching an end, but then you see more issues, more problems appear. But thank you very much for that overview. Last but not
sorry, if I can comment,
please do.
I just forgot something to say that will make people here happy. I think the preliminary index from Israel may show that the vaccine would stop the infection. I mean, it would be nice. It will not. It prevents the infection of others.
That's good news to hear. Yeah. Good to finish on a good note. Thank you, Doctor.